alcohol and antibiotics. Do they really matter? Can you mix them? Lots of things in the past have talked to us about maybe we shouldn't do this. So welcome to Talking with Docs and Dr. Brad Wiening.
I'm Dr. Paul Zalzal. What's with your voice?
Honestly, I feel
Did
perfect.
you smoke a pack of cigarettes before this?
No, I wasn't called last night.
Is this some kind of N=1 experiment?
I feel like when I get bad sleep, my voice is like this, but I feel good, but who knows? Maybe I'll find some, but
All right.
I don't know.
Okay, so alcohol and antibiotics. Is it a big deal? And if it's a no big deal, where did all this info come from?
Right, so I think it's God telling me to talk less, talk slower, and talk quieter.
God, I've been telling you that for months.
So most of it started in the Second World War. So in the war, a lot of soldiers misbehaved when they were away from home for long periods of time, stressful situations.
It happens.
And venereal disease was not uncommon in soldiers.
Sexually transmitted infections is what we call them now.
STIs.
Not STDs as they used to be called.
STIs. And they were often treated with antibiotics, particularly penicillin for things like gonorrhea and syphilis, which were the two most common ones.
Right.
And doctors believed at the time, not based on any scientific evidence, that if you drank with these, it would reduce the effectiveness. And that was one of the reasons they advised not to mix the two together. But the other one was probably to curb behavior. They wanted their soldiers to behave and not engage in risky behavior, increase the chances of spreading the STIs to other people and having other problems. So that was probably the main impetus for the World War II. Hey, don't drink when you're on antibiotics. Why don't you just behave?
That's kind of funny. They don't want soldiers to engage in risky behavior.
Here's a gun. Here's a gun.
Yeah.
Maybe don't go have unsafe sex in the community.
Okay to kill people.
So that was the first part. Then, as
that was before the 60s movement, make love, not war.
Ironically, we're going to talk about the 50s. So in the 50s, as alcohol use disorders became more common, a medication called Disulfiram was invented. This is a medication that when you take it and then subsequently drink, it makes you feel sick. You're nauseous, you sometimes vomit, you can have an elevated heart rate, and can have flushing. So it was used to treat alcohol disorders.
Right, and we still have medications like that.
Absolutely.
Anti-abuse and things like that.
Well, that's what, Disulfiram, So that medication was invented. And then 4 years later, an antibiotic called metronidazole, trade name Flagyl, was used for common GI infections, sometimes other infections, was invented. And scientists noticed that when people were on this medication and they drank alcohol, it had a disulfiram-like reaction. So people felt sick, so they said, you shouldn't mix these two together. And that's still true today.
Okay.
If you are on Flagyl or metronidazole, you should not drink alcohol because you're gonna have this very negative reaction.
Okay.
But then I think out of convenience, it was broadly put on people to say, hey, don't drink if you're on antibiotics.
Okay. So first of all, we're not advocating drinking alcohol.
No.
We recognize, though, that a lot of people do drink alcohol.
We have videos about this.
Yeah, different amounts.
Yeah.
And certainly we have had drinks in the past and probably will in the future.
Yes.
But we know that any amount of alcohol is bad for you.
Yes.
But in terms of the caution of drinking alcohol while taking antibiotics, Dr. Ween's just explained where the sort of history of it comes from. But let's look at it now from a scientific point of view, basically.
Sure.
We know that alcohol is metabolized by the liver.
Yes.
For the most part. And we know that a lot of medications are either metabolized by the liver or the kidneys, right? That's generally how your body gets rid of stuff. Alcohol, liver, things like anti-inflammatories are kidneys, things like acetaminophen are liver, and then antibiotics come in with varying, kidney versus liver ways of excreting them.
Right.
And so generally the thinking is, without a ton of evidence,
Why are you talking so loud?
Because you can't. Generally, the thinking is that if you're drinking alcohol and taking antibiotics, you're either going to reduce the effectiveness of the antibiotics or reach a level of toxicity if you impede with the way that either one of them is
Right, and I would say
excreted.
The body of scientific evidence says, hey, it's probably not going to affect the way that the antibiotic works specifically. It's probably not going to reduce the concentration of that antibiotic unless you're drinking excessive amounts to the point where your liver is taxed.
Right.
Or we know that drinking large amount of alcohol can suppress your immunity, your generalized immunity.
Right. So the issue is, it's not don't drink alcohol while you're taking antibiotics. It should be more like don't drink alcohol while you have an infection that requires antibiotics to cure.
And maybe say don't ever drink a lot of alcohol. I think we've done videos about this, that it's the excessive amount in the binge drinking that actually is even worse for you because it overwhelms your liver.
Were you partying last night? Is that
I
what
was
you're
on
getting
call.
at?
I literally did a hip fracture.
Okay, because you sound.
Yeah, no.
Okay. So what's the bottom line then?
So my bottom line is, when you're sick and you're taking antibiotics, you probably should consider not drinking, not because it's going to make them not work, but because it's not going to optimize your health.
Right. And it's funny because my mom always used to say, when you're sick, you have a tea with cognac to help a sore throat.
Interesting.
Right? Maybe you just don't care about the sore throat anymore. But that was her thing.
Interesting.
Right?
Okay.
Tea with cognac. I remember that. And there's some alcohol.
Do you do that still or no?
No, I never did then either.
Yeah.
I'm not a big cognac fan.
Yes.
I don't drink a ton of tea either.
Many leather.
I translated it to a beer.
Yeah.
No, I didn't. So basically, with the antibiotics, there's certain antibiotics that you shouldn't take it with. For example, the metronidazole we talked about. But generally, it's not going to interfere with the antibiotics. But it might interfere with your body's way of getting over the illness. What about other medications?
So I was just going to say, I would always discuss this with your doctor or your pharmacist, whether alcohol can negatively impact the effect of any of your medications. And probably one that's top of our list that I talk to my patients a lot about is actually anticoagulants or blood thinners.
Yeah, that's a good one, because the way blood thinners work is they interfere with the clotting cascade. Your body has this clotting mechanism so that blood clots. When you cut yourself, you don't bleed to death. It's a clotting mechanism. There's an intrinsic pathway, an extrinsic pathway, and a lot of that is handled by the liver. A huge amount of that is handled by the liver. And so different blood thinners interfere with different parts of that clotting pathway. And the thinking there is that alcohol, which does stress your liver, can interfere with these medications and actually make you more susceptible to bleeding if you're taking alcohol and taking one of these blood thinners.
Yeah, for sure. Warfarin or Coumadin, I'd say that's probably number one.
Right.
There's less evidence for the newer class of anti-10As like rivaroxaban or Eliquis or Apixaban. Less evidence for them, but I think still it's proceed with caution and definitely concern.
Yeah.
And what I would say is 100% don't drink a lot of alcohol.
Yeah.
But whether or not you had a wedding or something like that, or some type of celebratory event where you felt obligated to have a glass of champagne.
Because you're making a toast.
Because you're making a toast. Even then, you'd probably get toast with sparkling water or
Yeah,
something. But
you don't want to.
you don't have to have the drink. But if you did, it probably is okay.
Yeah.
But
nobody looks good toasting with a bleeding nose.
No.
Right? My recommendation would be like no alcohol if you're on blood thinners. That would be my recommendation. And we know that as people approach liver failure, if you're drinking excessively or you have liver failure for other reasons, bleeding, bruising is one of the signs of liver failure. So that'd be my recommendation with blood thinners. Any other medications?
Antidepressants, I think same thing. A lot of them are any type of sedative. Obviously can exaggerate those effects because alcohol is a respiratory depressant. So I think bottom line is, if you're going to drink and you're on medication, talk to your pharmacist or your doctor.
Yeah, and on antidepressants, again, just like with the infection, alcohol is usually one of the things you cut out if you're suffering from depression. So that'd be something you'd cut out before you even start a
part of the treatment.
Pharmacologic treatment for depression. But in terms of interfering with it, like you said, they both can be respiratory depressants, so definitely double the sedative effect if you're taking some kind of sedative. Or sleeping pill, for example.
100%.
That's another one. Once I accidentally took Tylenol cold nighttime medicine before I went out to an event and had some drinks, and I can vouch for the fact that there is like a doubled sedative effect.
That was sleeping on the couch, guy.
Dancing on the dance floor, more like, but it was then later sleeping in the cab ride home.
There you go.
So yeah, you have to be careful with that kind of stuff.
There you go. If you like this video, please like it, subscribe to our channel. Leave a comment if you like the fact that Paul is significantly louder than me today.
Yeah, I'm going to get you a Ludens for the next video.
A Ludens, okay.
Remember, you are in charge of your own health.
We'll see you next time.